Now, as we mark 100 days since South Africa went into lockdown in a bid to mitigate the spread of the coronavirus, traditional healers say they've been snubbed in the fight against COVID-19 following claims that Artemisia herbal tonic cures COVID-19 in Madagascar. Herbalists and traditional healers in South Africa have called on the health department to have a stake in fighting the pandemic. Artemisia is locally known as uMhlonyane or Lengala and has been used since time immemorial to fight flu. In fact, I went home yesterday to visit my mom, and I might get into trouble for this, but Lengala. And let's welcome now on Skype from Durban, traditional healer Bongolethu Mzozo, who's popularly known as Dr Khehlelezi. Inyanga yodumo. Very good morning. Thank you so much for joining us. We on 100 days of the lockdown, but the spread of the virus is continuing to rise. What role can traditional healers play in this fight?
First of all, I would like to say good morning, South Africa. And secondly, what I will say is, us as traditional healers, we need to be strong enough and start manufacturing or coming up with a queue whereby we will fight this. And we are pleading the government to give us a chance. I, as Dr Khehlelezi, have created something whereby I said people need to use so that we can try by all means to fight this pandemic or to fight this disease which is affecting people. And what's troubling now is I can see that the popular, it keeps on, the number, it keeps on increasing, going up. So people need to be strong and fight this. And one day we will have the proper thing to fight it.
One of the major activities or activations that the Minister of Health, Dr Khehlelezi, embarked on at the beginning of lockdown was to engage with traditional healers. Why are you feeling left out when seemingly government is extending a hand to the sector to say, help us find solutions?
The reason why we feel left out is because, one, there was no proper meeting or proper announcement where they are saying traditional healers, maybe we need to have a meeting with Honorable Dr Khehlelezi. We are feeling left out because whatever we are trying to come up with, maybe something, a medicine that we are trying to come up with, they don't consider it. So we are pleading and we are asking the government to listen to us and test whatever we are bringing, the medicines that we are bringing. As I've just said before, that I do have something which is called Slay Queen, which I'm giving out to people, and the response that I'm getting from people, it's crazy and it's very, very good, of which I'm pleading to the government to consider that medicine, that can you please try to give people this, and it will definitely protect them. And as a traditional, I'm not saying people must stop using the mask. They must follow the rules that we are given by the government. Put on your mask, sanitize your hands, you must stay clean so that you can fight this.
Why did you call it Slay Queen? Is this an effort on your part to try and make traditional healing fashionable to young people?
Yes, definitely. The reason I call it a Slay Queen, in most cases, when you call your medicine Zulu medicine with a Zulu name, people don't even respond. But the moment you call it in an English name, they start like looking at, what is that? What is that? The reason I'm calling it a Slay Queen, it's because it was most made for women to fix their marriage. But as time goes on, I discovered that, you know what, let me add this, that, and then the response that I got from people, it was very, very good when it comes to this pandemic, the coronavirus which is there, and people are responding, and it's all over South Africa now. Even overseas people are taking and buying it from South Africa, going to overseas, whereby they are trying to fight this disease.
How can we find that place where we clarify that disconnect in the people's minds about how to connect with traditional healing and modern medicine? What are the differences? Where do we need to connect so that people don't view it as something ancient or something that doesn't work?
Okay. What needs to happen is they must always have some shows. When I'm saying some shows, they must make people get used to the traditional healers, because now in our days, if you can take a traditional healer, maybe someone who's staying in Sandton, or some people, those who are staying in urban places, they are not used to traditional healers, because at first, when you look at this, when it came at first, they were saying, no, we will pray for this and it will go. And God, you cannot differentiate, you cannot separate a human being and a tree. Those people, they are working hand in hand in whatever case you can do. So people, they need to have a show, or they need to have some soapies on TV whereby it's a traditional thing. People must learn, and they must understand the traditional medicine, and they must understand their culture. Because most of the people, they don't understand all these things. That is why it ends up not clicking together.
So what's the way forward in terms of your relationship with government? I hear your assertions. You're saying that the initial meeting didn't really... do you feel that it wasn't effective, or he didn't talk to a broader base of traditional healers? What are your concerns in terms of that first meeting that the minister had with traditional healers?
Okay. What I think what needs to happen with the government needs a proper, as I'm saying, I've said this before, they need to call us in. We do have big followings. There are some traditional leaders with a big following, whereby people, if I say something, my people will listen to me. And the other thing, the traditional healer needs to emphasize that people need to put masks, need to sanitize their hands, and then they need to listen to the government before everything. And this uMhlonyane, they mustn't misuse it. They must use it, and they must work hand in hand with the Western doctors. If we can work hand in hand with the Western doctors, we'll share the different ideas. Once we share the different ideas, something will come out there.
Dr. Khehlelezi, that point you've just raised is so important about traditional healers being influential. So I'd like you to use this platform right now to talk to South African men. We've just come out, before talking to you, from a story talking to a brigadier in Mpumalanga, where he says children as young as 1 year, 6 months, 1 year, 8 months are being raped. How can you use this influence to address South African men?
I would say I would like people maybe to even follow me a lot on my Facebook page, which is Bongolethu Mzozo, because I'm always live, whereby I'm talking to this month. It's a man of men's month. Yesterday I was even doing that, talking to the men, where I was telling them, guys, you need to have some breaks. When I'm saying breaks, you need to hold your horses. If you are a man, you need to think of the ladies. They always come first. In South Africa, that's what we are saying. Ladies need to be treated in a manner, golden way. We need to respect our children. We need to be the example, good example to our children. So if we still have men who are still raping, the government needs to step in, and we need to have some workshop whereby we're saying, okay, this Sunday we don't want ladies, we just want men, whereby we are talking to men to men. We're talking to each other, sharing different ideas. So they need to follow me a lot. It's either on my YouTube or on my Facebook page, which is Bongolethu Mzozo. They will see. I always teach them. I always tell them what to do.
All right. Thank you so much for talking to us today. and reminding us about the importance of government incorporating the activities of traditional leaders in their responses to COVID-19. That was Bongolethu Mzozo, a traditional healer, popularly known as Dr Khehlelezi Inyanga Yodumo, giving us his views on COVID-19 and how they feel as traditional healers, that they're being sidelined and not given opportunities to assist. You're watching The Agenda. Let's take a break.